November is Type 1 Diabetes Awareness Month. So, T1D, Type 1 Diabetes. A lot of my information is from the Breakthrough T1D. It was formerly JDRF, stands for Juvenile Diabetes Research Foundation. They have an annual summit, and I went to that earlier this year. And I thought I'd share some of the information that I got from that summit since it's Awareness Month. So, first things first, I took some notes on my notes. Shortened it a little for you guys because you don't have 3 hours, I'm sure. But it's a chronic autoimmune disorder. Triggers are generally unknown. It's suspected that there is a very strong genetic link. There are certain genetic markers that you can be tested for, and the more of those you have, the more likely you are to develop it in your lifetime. Right? Before you have full-blown diabetes or stage 4, there are 3 stages. In the first stage, you still have pretty much normal blood sugar. Everything's just getting started. You haven't really had any of the symptoms yet. But your immune system is going, wait a minute, something's wrong, right? In stage 2, things are starting to go a little haywire, but they're not like out of the safe ranges. It's not constant. It's not consistent. It's nothing that they can really catch easily, right? By stage 3, that's when you're having the severe hyperglycemia, you're insulin dependent, and it segues into full-blown type 1 diabetes. There are things that if you are able to catch it soon enough, they can put you on medications to preserve the cells that create insulin and glucagon, which are the hormones that your pancreas creates to process glucose, which is what carbs are turned into to fuel the cells of your body. So, one scary thing is a lot of adult patients are actually misdiagnosed with type 2. So, if you don't really have a family history of type 2, you have a relatively healthy lifestyle, and there's not really a reason for you to develop your type 2 diabetes, then, but you find yourself being told that you're pre-diabetic or your onset diabetes, there's a chance that it might be adult onset type 1 because it can happen anytime during your life. There's juvenile, there's adult onset, there's even geriatric type 1 diabetes. So they don't know what triggers it. It's most common in children and juveniles, but not 100%. My son was diagnosed at age 2, and he is 10 years old now. We've got the insulin pump. We recently had our first what's called an occlusion, where the insulin can't get through the cannula to be delivered to the body. And that was the scariest thing. Well, the second scariest thing. The scariest thing is when he ended up in the hospital on the border of going DKA, which is a whole other issue. Diabetes is terrifying. So, adults, parents, especially with your kids, okay, these are the things that you should be looking out for. You know, the symptoms is things like excessive thirst, excessive urination, sudden bedwetting when there wasn't bedwetting issues before, things like that. Mood swings, general discomfort with no known cause. When your blood sugar is high, it literally turns your blood acidic and can start eating you from the inside out. It can affect your heart, your kidneys, your liver. It's all bad, right? So just even general discomfort and you don't know why can mean your blood sugar is going high. And there's lethargy and sallowness. The lethargy and the sallowness can also be seen in an absolute extreme with low blood sugar. And with low blood sugar, you also have risk of seizures and a higher risk of coma. High or low, coma is a risk. You are likely to develop seizures as your blood sugar drops. My son's actually had a seizure from his low blood sugar before, and it was absolutely terrifying. Like I said, it's not a fun illness to deal with. So, please be aware. Watch for the symptoms. Listen to your own body. What do you feel? Do you have a history of this? Why is this suddenly happening? You know, make sure you take care of yourself, because if you're misdiagnosed with type 2 as an adult, you're going to have the wrong treatment. And with the wrong treatment comes a whole new slew of complications and side effects that you do not want to have to deal with. So remember, happy November, diabetes, type 1 diabetes awareness month. If you have a child that has diabetes and they have siblings, or you're curious, you can actually ask your doctor, either your pediatrician or your endo, if you can get the testing done for it. Most direct family members can be tested for free. And you can buy the test if you're curious and you don't have any immediate family members. You can buy the test just to see if you have any of those genetic markers. Um, so yeah, that's my little spiel on type 1. Be safe out there, listen to your body, and work with your doctor. Make sure you figure it out. Okay, love you. Bye bye.